This PowerPoint will build on our prior conversation about informed consent. We're going to talk about children today, and children are defined, or minors are defined under most state laws as under the age of 18. That's kind of a bright line rule that, of course, is full of exceptions, kind of the Swiss cheese that keeps me employed. So let's dig a little deeper into that concept. We're going to be talking about obtaining consent for a child, whether that in a number of different scenarios today. We'll talk about the emergency situation, and we'll talk about where a parent refuses to consent, as well as where the parent is unavailable. Let's talk about a number of exceptions to the bright line rule of age of 18 first. The first is what's referred to as an emancipated minor. There are very few of these creatures out there in the world. It actually requires a formal court order that declares that the child has been emancipated, liberated from the control and responsibility of her or his parents. And that is fairly detailed criteria that is used by a court to make that determination. It is not a self-proclamation, as despite what many children or their parents might want to tell you. The other exception is a child who has been or is married under the age of 18. Apparently, if you make one bad choice, you can go for two. But under Virginia law and under most state laws, if you are married, you're able to make healthcare decisions for yourself, regardless of your age. Another exception to the bright line rule is the girl who is pregnant and or delivered. The bit of an absurdity in the law is that a pregnant girl or woman has the ability to make healthcare decisions for herself and her child during her pregnancy, and when her child is born, she always has the priority in making decisions for her child, regardless of her age, because she is the parent. However, she loses the right to make healthcare decisions for herself once her child is delivered. A bit of an odd conundrum there, because obviously many children born to very young mothers are very high-risk children that require very difficult decisions to be made. A few more statutory exceptions, and most of these appear under Virginia Code 54.1-2969. The first is that a child of any age can consent to treatment of any reportable disease. And by reportable, we mean anything that is tracked by the Department of Health or CDC. That statute's written fairly broadly, probably overkill for what it is intended to address. But the goal, of course, was that children of any age could seek treatment for sexually transmitted diseases. But the way the statute is written, a 12-year-old who has the sniffles from a virus, from the flu, could seek treatment on their own volition. That is a distinction that's maybe important in that the child can seek care. It doesn't require that the child pay for the care. It is still the responsibility of the parents to pay for necessary treatment for their children. And that, of course, is subject to debate as to what is necessary treatment. Likewise, a child of any age can seek and be prescribed family planning care without parents being aware of it or parents having to consent to it. A child of any age can consent to outpatient mental health care, whether that's counseling or even medications that are prescribed for mental health care. And last but not least, a child of any age can seek and be treated for alcohol or substance abuse on their own consent without their parents being involved in that conversation. As you'll see, all of these are within the social goal of encouraging children to seek treatment in the scenario where they may be embarrassed or scared of talking with their parents about their condition. Now, it's important, and we'll talk about this further in the medical information management section, that just because a child is permitted to consent to these things, first of all, it does not bar a parent from obtaining medical records related to a child's care, unless the provider invokes what's referred to as the statutory or as the therapeutic exception that we'll talk about under MIH or HIM, depending on where you go to school. And likewise, a parent is obligated to pay for necessary care for their child. That is a somewhat complex situation sometimes. There's a number of cases out of the Waynesboro, Harrisonburg area where a father sought not to pay for his daughter's abortion, and the court agreed with him that that was not a necessary treatment. However, when she had a post-abortion infection and required hospitalization for treatment of that, the court deemed that to be a necessary treatment. An interesting approach. Let's pick up now with the topic of where a parent refuses care. And the first scenario we'll talk about is in an emergency situation where a parent refuses care. And this may come up in the situation of Jehovah's Witnesses, Christian Scientists, other religious practices where they don't believe in allopathic medicine. In those sorts of situations, and this is more practical advice, is that first, it's important to involve Children and Family Services or whatever social agency takes care of children in your jurisdiction as quickly as possible to allow them to make their decision as to whether or not the child is subject to neglect or abuse. The other practical part of the advice is that it is always easier, as I've mentioned before, to defend a lack of consent case than it is a wrongful death case. If you are waiting for or trying to get a ruling from DCFS or from a judge as to consent for a child to be treated in an emergency situation where a child's well-being is in danger, I would recommend that you are in fact better off to treat that patient and sort out the legal pieces later. Now, if you have a situation where a parent is making their decision and it is a well-recognized scenario, such as the Jehovah's Witness who refuses blood transfusion, the better option there is to do your best as to how you can work around those religious convictions. And there certainly are many opportunities, for example, blood replacement, to use other fluids to try to work around potentially a cell saver, those sorts of things. But again, of course, the child's safety and survival is paramount. Another scenario that we're seeing quite often these days has to do with parents who decide that they are not going to engage in preventive care for their children. That is an interesting conundrum. Certainly, you may be aware of a large movement out there of parents who are refusing to have their children vaccinated, putting much of the rest of us at danger as well for diseases that were long ago disappeared, whether that's whooping cough or measles or polio. And in those situations, each state has taken a little bit different approach. The majority of states, including Virginia, allows for a religious exception. Some states, such as California, it doesn't even have to be a religious conviction. It just is a serious conviction, a moral conviction that the parents do not desire for their children to be vaccinated. In situations where a child is, again, in danger, the appropriate approach is to notify DCFS and or seek a judge's order to compel the treatment. And several of these decisions have come up in scenarios such as where a child has had a heart defect that could be treated by surgery. And in that case, in Northern Virginia, the judge elected to compel the surgery, and that while the child may have religious convictions, it's improper to impose those on the child. Again, those are very case specific and have to do with the facts at the time and are very emotional for everyone involved. Let's now take up the situation of where a parent is not available to make healthcare decisions for a child. The classic scenario, of course, was where the wealthy parents cruised off to Europe for the summer, and there was no one around to make decisions for the children who were left in the custody of a nanny or someone else. That obviously with communications these days is not very common to occur. The more common scenario is the child simply has been left with grandma or with an aunt or with some other person to raise. And now the child needs some sort of health care, and you're looking for consent. There is provision in Virginia law for someone standing in the shoes of the parents to make healthcare decisions. The good Latin term is loco parenti. That is fairly treacherous ground to base a decision on, in that, of course, parents may show up out of the blue later and not be too happy about how that decision was made. However, it may be all that you have in the moment. First and foremost, of course, is the well-being of the child, and if the child is at risk for their well-being or life, care of that child should be your paramount concern. If it is something that allows more deliberation, it is certainly appropriate to notify DCFS in that we appear to have a child that is not in parental custody and may be at risk of neglect or abuse. And it is also appropriate to seek a ruling from a judge as to approve or confirm the healthcare decisions that you're recommending. All of those are a bit difficult in practice, but is the only means that we have available. That brings us to the conclusion of our conversation about informed consent for children. It will come up in several of our future PowerPoints on related topics, but that's all for now.